So I've got another tactical question, and then we'll go back to the crowd. So a lot of people here in this room. So we've got two, basically marketing gurus, essentially, right? Can we call you that? Basically, right?
I used to be one.
Yeah, right.
I'm a recovering marketing guru.
And just a guru over there. So a lot of people are probably spending a lot of time thinking about how to get more patients, right? Do you have any advice for those people, or actually to get more people? Actually, if you were to reframe, or families.
Well, there's something burning through my mind on what Harrison said, right. And I would write it down because I sort of wrote it down. If I was doing category design for any of your businesses, there's a way to differentiate, and it's a bit of a mind bender. If you led with who you work for, what's the difference? Why would I choose your practice over another? It's like, I work for you. And if you want to know, if you want to test the market, ask everybody else who pays them. That's different. I'm sure that those doctors are very highly qualified, and those specialists are highly qualified too. Then all of a sudden, you establish that difference. And then obviously there's ways to then put that out into the community and start to virally build it through your community and all the rest of the ecosystem plays. But I think it starts with give somebody such a clear choice that you don't end up spending all your time in marketing efforts and promotion efforts convincing people. Just show them. It's like, hey, who do you work for? I work for you. If you want to choose somebody who's kind of more reliant on that insurance policy and the premiums, knock yourself out.
So I would say now that there are 621 established direct care practices,
nice.
there are people in this room that have figured this out, that have gone through the iterations, that have gone through the hard work to figure out either how to convert or how to recruit. And I would use a conference like this to be pulling stuff out of other people's brains and finding a way to get this on. This is the first time I've heard of Hint Community, so I don't know exactly what Hint Community is, but I suspect this is a way to get this stuff posted out there for other people to see it. So if there were 10 practices out there that were still figuring it out, trying to make it up and test on your own is one way to go about it, but there's 621 practices out there, and many of them have figured it out.
You make a really good point. The most powerful ecosystems are run by not the tech companies, no offense, don't kill me on this, but they're run by, in tech space they call them user groups, which I think is a stupid name, users, but in general, it's the customers that build the communities, and they self-advocate. So everybody in this room, I don't know how you got 300 people lined up so fast, but there's a lot of goodness in this room. Build your community out there, and then draw in the rest of the leaders from the tech community and such. So,
yeah, I mean, I give startups advice all the time, and I'm a huge believer in what Dave is saying in terms of category. I say, sell your category, you're going to get more than your fair share of the category.
Brilliant.